So hello everybody, my name is Alberto Cantizani López and I study medical anthropology in the University of Amsterdam. I first want to talk about my motivation to give this talk. I have been following the development of the psychedelic renaissance in the last years, and as a collaborator in psychedelic research organizations, I am most of the time always surrounded by colleagues with more of a natural science background. Me coming from the social sciences, I often then take this role of encouraging interdisciplinary dialogue, trying to also bring attention to the voices that are not always heard in the field. This talk is in a way an effort to hopefully open such interdisciplinary dialogues in psychedelic research, and it is thought as an explorative, as an exploration of innovative methodological pathways that may allow us to improve psychedelic treatments. And more concretely, I would like to make a case for the introduction of ethnography in the study of psychedelic efficacies. So I want to start by remarking how psychedelic research has historically been confronted with methodological tensions arising from the application of randomized placebo controls to what is essentially a form of psychotherapy, not a form of pharmacotherapy. So these RCT methodologies has definitely become the golden standard of quality in conventional psychopharmacological research. However, it seems to be ill-suited to the study of a form of treatment where the blinding and the standardization of treatment conditions is fairly complicated. And this is something that researchers, psychedelic researchers, are well aware of, and also something that critics often point at as a weakness of psychedelic research so far. So in his book about the LSD trials being conducted in the 60s and 70s, historian Matthew Oram shows how early psychedelic researchers testing the efficacy of LSD on alcoholism were often confronted with a dilemma. It was a dilemma between adhering to the most rigorous methodological controls of RCTs on the one hand, or attending to the set and setting of psychedelic treatments and caring about the psychotherapeutical process of patients on the other. That is a dilemma one could say between control or care. So he shows how whenever researchers went down this path of control, that is whenever they made sure to blind treatment conditions and neutralize the environmental variables that may influence drug actions, then they disregarded the therapeutical process that the drug was supposed to facilitate. And therefore, the results of such studies tended to show low efficacy of LSD in the treatment of addiction. Then, on the other hand, whenever they took care of the therapeutic process, for example, by preparing the patient for the experience in pre-sessions, by optimizing the setting in the therapy room, and by integrating the patient's insights in post-sessions, then studies were deemed as methodologically poor and were often considered unconclusive in spite of promising results. Matthew Oram actually in his book actually argues that these methodological tensions and this dilemma was an important factor that eventually led to the failure of the first wave of psychedelic research. And these tensions can be explained by the clash between two models of understanding the effects of drugs. A clash between the biomedical logic of RCTs on the one hand and the maxing of drug set and setting on the other. RCTs work under the assumption that there is a biological drug effect that can be isolated from all of the psychological and environmental factors. And therefore, the experimental group to which the drug is administered is compared to a placebo control group in clinical trials to which everything else but the physiologically active ingredient is given. So put more simply, it's like by extracting the effects observed in the control group from those observed in the experimental group, then you can obtain a measure of the drug effects. But in contrast, set and setting theory claims that the context is an integral part of the synergistic effect of psychedelics. So while these environmental variables are treated as noise to be controlled or neutralized in RCTs, they are rather something to be cared for and optimized in psychedelic therapy. So discussing these methodological tensions with a psychedelic researcher, I was once told, yes, there are methodological difficulties in psychedelic clinical trials, But if we drop RCT, what are we left with? Only single case studies with nothing to compare them to. And here I must disagree with my colleague. I think that qualitative research, far from being just mere single case studies, can actually generate valuable evidence. And however, this kind of research has not really been up on the agenda of psychedelic research. Through ethnography, which is the main method employed by anthropologists, these qualitative researchers have studied the practices or the performative aspects, as well as the social discourses and the meaning that surround drug use. And I don't really have so much time to elaborate on the details of ethnographic methods, but we can say that they're based on a deep immersion and participant observation of the researcher in the field of interest. They include, but they cannot be reduced to interviews. And their object of study is not necessarily culture, but any kind of practices and discourses in a certain context. And so in collaboration with informants, the ethnographer fulfills this task of articulating the practices and discourses, that is scrutinizing them, interpreting them, and putting them in words that make them translatable so that their meaning can travel to other different contexts and so they can be reflected on more widely. So my question is, how could ethnography contribute to a methodological shift in psychedelic research? And I would like to suggest 3 potential ways in which ethnography may shift the research focus and our understanding of drug effects. The first one is a conceptual shift, and represents a shift from drug effects to relational effects. Conventional psychopharmacological research is characterized by a linear and deterministic cause-effect logic when it comes to drug effects. And according to this logic, the observed outcomes are effects that follow from the pharmacological properties of drugs acting at a molecular level in the brain. So previous pharmaceutical research on depression with SSRIs, for example, fit this scheme perfectly. And one could say also that a big part of current neuroscientific research on psychedelic substances does as well to a certain extent. In the anthropology of drugs, instead of attributed to the agency of the drug, effects are distributed across a diverse network of interacting elements. It's a network which may include patients and their relatives, therapists, music, space, and so on. Effects here depend on the relations among these actors and how these relations are performed in their interactions. What is meant exactly by their relations is, for example, where and how is the drug administered, along with which music playlist, how does the patient feel in such an environment, what are the previous experiences of patient and the previous experiences of therapists as well with a psychedelic substance. And for example, what do people in the patient's social circle think or believe about this substance? Psychedelic effects are the result of the way these relations between therapies, space, patient, music, and substance are performed during the therapy. And obviously, pharmacological action in the brain is also an important thing, but it is only important as far as it is situated in a more complex and extended configuration of use, and not just as an unmediated universal property. And I insist here, the material or biological part of the treatment is not to be neglected, but at the same time, the treatment should not be reduced to pharmacological action alone. The second shift relates to the methodological implications of the mentioned conceptual shift in the notion of drug effects. So as we've seen earlier, RCT methodologies, they attempt to isolate drug effects from other environmental factors, right? And by doing this, clinical trials are not so sensitive to how drug effects are mediated by context. So think about it, like once these treatments are approved and roll out in society, the set and setting configuration that determine their effect and the way the therapy is conducted by clinicians will very likely change from the current laboratory conditions of RCTs. That's why a deeper understanding of the contextual, of the performative, and the non-pharmacological effects of psychedelics is required. And in order to do that, we must shift from isolating effects to situating these effects in relation to contextual elements. So if drug effects are relational, then we must look at the relations between the actors and their arrangement in a given configuration of use. Rather than looking at drug action in isolation, we can elaborate thick descriptions of healthcare practices and reveal the tensions that they entail to patients and doctors. So in conversation with these actors and also in close examination of these relations in the clinical context, we may be able to bring some nuance at how drug set and setting interact. So when looking at these entanglements of actors, we may ask things like, what does the music evoke at different stages of the psychedelic journey, and how to best fit music to the therapeutic process? What kind of insights or visions do the patients experience in relation to their loved ones, and how can this material be therapeutically used or interpreted by the therapist and the patient? Or how do spontaneous gestures of therapists during the drug session or their own relation with the substance shape trust in the therapeutic alliance? The third shift is about the utility or the purpose of research, and defines a shift from proving efficacy to improving care. In this sense, our RCT trials do a good job at providing evidence for existing treatments. But as it has been suggested by Dutch anthropologist Anne-Marie Moll, not all healthcare research should be organized as a way to convince policymakers of the quality of existing care. Research can also be structured as a form of self-reflection. So if so, then instead of pouring resources on the rolling out of clinical trials to prove the efficacy of these substances for all kinds of indications, we might actually want to prioritize research that looks at how to improve psychedelic care. And here I want to suggest a redefinition of RCT as reflective, careful tinkering. Reflective because, as I said earlier, research can also be structured as a form of self-reflection. One that, as in contemporary ethnography, is based on collaborative approaches along with participants, and that in fact privileges the input from patients. Careful, not so much as in cautious, although that is also a good virtue, but as in care-focused. Research that is patient-centered and that foregrounds the caregiving practices adjunct to drug treatments and the multiple practicalities and concerns involved in the work of medical care. And finally, tinkering, because it is about exploring the possible relations of the patient with the music, with the space, with nature, or with meaningful objects that may be brought in during therapy, and how these relations contribute to the therapeutic outcomes. Not by standardizing all these elements, but by adapting them to the particularities of the patient and to the therapeutic process. And in tinkering, we accept that whatever works does not work in a deterministic manner. It is rather erratic. Treatments do not just have a certain effectivity, but they just induce multiple effects that can be mobilized to different ends in the particular therapeutic process at hand. So in summary, anthropology might offer some theoretical and methodological tools that shift psychedelic research from a pharmacological notion of drug effects to that of relational effects, from the disentanglement of environmental, biological, and psychological factors to the entanglement of substance set and setting in practice, from proving the efficacy of a substance for certain indication to improving the quality of caregiving practices, and all in all, a shift from control to care. We have come to equate evidence-based medicine with quantitative methods and more concretely to the implementation of RCTs, but there are other forms of evidence available that can be of value to study drug effects, to inform drug policy, and to improve our treatments. In this talk, I have briefly outlined these possible theoretical and methodological shifts that psychedelic research may work towards in dialogue with the anthropology of drug use in this case. But of course, these kind of proposals, they need to be further elaborated in an interdisciplinary dialogue among experts and stakeholders, taking also into account the scientific, the financial, and the ethical boundaries within which research must take place. Finally, I just want to encourage all researchers engaged in the study of psychedelic effects to explore these ideas and to take seriously the inputs that may come from other disciplines in the social sciences and in the humanities. Thank you so much for your attention.